Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Omeprazole. And we're starting right now. Just keep in mind that this channel is for information purposes only. The first thing to discuss in this presentation is what Omeprazole is used for. So Omeprazole typically treats heartburn, a damaged esophagus, stomach ulcers, GERD, and conditions that generally cause your stomach to make too much acid. We'll now discuss how to use Omeprazole. So your doctor will tell you how much medication to take. Do not take more than directed. This medication should come with a medication guide, so ask your pharmacist for a copy if you did not receive one at the time that you were picking up your prescription. Take this medication before meals and for the full treatment duration, even if you feel better before the medication is finished. Follow the instructions on the medication label if you are using this medication without a prescription. So if you are using the over-the-counter medication, do not take it for more than 14 days or use treatment more often than every 4 months, unless your doctor tells you to. Now what happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, skip the missed dose and take the regular dose when the time is appropriate. Never take extra medication to make up for a missed dose. We'll now discuss some warnings associated with Omeprazole. So tell your doctor if you are pregnant or breastfeeding, or if you have kidney disease, liver disease, lupus, or osteoporosis. This medication can cause diarrhea. Call your doctor if the diarrhea becomes severe, does not stop, or is bloody. Do not take any medication to stop the diarrhea until you have talked with your doctor. This medication may cause the following problems. So kidney problems, increased risk of broken bones in the hip, wrist, or spine. This would be more likely if the medication is used more than once a day and for more than a year. Lupus, or abnormal growth in the upper part of the stomach. Tell any doctor or dentist that you are using Omeprazole. This medication may affect certain medical test results. Your doctor will do lab tests at regular visits to check the effects of the medication, so be sure to keep all your appointments. Over the next couple slides, we'll discuss side effects or adverse events. Over the first 2 slides, if you experience any of these, you would want to get in touch with a physician right away. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, reach out if you have blistering, peeling, or a red skin rash. If you have fever, swelling in the body, unusual weight gain, change in how much or how often you urinate, or blood in the urine. If you have joint pain, a rash on your cheeks or arms that gets worse in the sun. Seizures, dizziness, uneven heartbeat, muscle cramps, or twitching. If you have severe diarrhea, or stomach pain, nausea, vomiting, loss of appetite, or weight loss. And lastly here, unusual tiredness or weakness. Now for these side effects here, you would just want to mention them to your physician at your next appointment or to your pharmacist when you're picking up your next prescription. So that could be mild diarrhea or stomach pain, as well as a headache. All right, everybody, that's all we're going to talk about today with Omeprazole. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember that you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.